I love him, but he got punched.
Oh.
And he was different when I came home, that's for sure. All right. So here's our upper extremity, right? Here's our deltoid. Here's our subscapularis. I'm not going to ask you this on this probably. If you start with the anterior, you've got your biceps brachii, you got your brachialis, and then you got your coracobrachialis. Now in the posterior portion, you've got your triceps brachii. If we go down, remember I said there's 3 on the front, 3 on the back, and then there's the 2 little ones that make up this cubital or antecubital fossa. That's your pronator teres and your hitchhiking muscle, or your brachioradialis. Then you go like this: palmaris longus, right here. This is your flexor carpi ulnaris, and then this is your flexor carpi radialis. Come to the back, your extensor digitorum, and then there's 2 here, right? An extensor carpi radialis, longus and brevis. If I point to this one, you're going to say extensor carpi radialis. Okay? Don't worry about longus and brevis. Even if I point to this one, just say radialis, extensor carpi radialis. And then over here, this is the extensor carpi ulnaris. That's it. I mean, that's basically your whole hand. Your extensor retinaculum and your flexor retinaculum, but we don't have a flexor retinaculum on this one, but you need to know. And it's the extensor retinaculum and the flexor retinaculum of the hand. Okay? What's that?
Are you going to need to know possession of the, like, are you going to of the right and of the left?
I'm okay with not doing that on these because I'm assuming you guys, you know, it's not like it's bones, like you guys kind of know that you can just kind of match it up to yourself. I'm assuming we all can kind of go right side, right? So I'm not going to be too crazy on that. Okay, so let's start with this guy. All right, we got our gluteus maximus, and I'll go through what's in there in a minute. This is our iliotibial band, or iliotibial tract. That's our tensor fascia lata, this guy up here. Come to the anterior. This is our rectus femoris. This is our vastus medialis. This is our vastus intermedialis. Sorry, our vastus lateralis. So vastus lateralis, rectus femoris, vastus medialis. If we take this out of here, there's a vastus intermedialis, and that makes up the quadricep, those 4 muscles. We come a little more medial. We have our sartorius, we have our gracilis, we have our adductor magnus, and our adductor longus. Okay? If we come to the posterior, we got our biceps femoris, we got our semitendinosus, and then we've got here our semimembranosus, which is really just a split of the semitendinosus. And this one is more medial. So this is the membranosus, tendinosus, biceps femoris. Then if you come to the side here, the tendons of the gracilis, the sartorius, and the semitendinosus come to this thing right here called the goose foot or the pes anserinus. Okay? If we come down lower here, you've got your gastrocnemius, you've got your soleus. Remember, if I point to this, that's your calcaneal tendon or Achilles tendon. If I have this looped around, that's your triceps surae. And then the only other muscle I needed you to know was the tibialis anterior, which came right off of your shin. And that was the one right here next to the tibia. And then this is the extensor retinaculum of the foot. And that's it on this guy. That's everything. When you do them fast like that, it's not, doesn't seem like much, right?
Okay.
Okay. Here's the shoulder. Here's the head. So the shoulder definitely would go over your ligaments. So here's your supraspinatus. Here's your infraspinatus. Here's your, here's your teres major, and here's your teres minor. Supra, infra, teres minor is almost like part of this infraspinatus, and then your teres major is actually this big one, and you can see it on the anterior side as well. And then this is your subscapularis muscle. Simple. Not many things there either. Which is the only one that's not part of the rotator cuff? Let me ask it.
What is the question?
What is the only muscle not part of the rotator cuff muscle? Nope.
The major, teres major.
The teres major, thank you, right? Teres minor. So that sits, just remember that T is teres minor, okay? That's the shoulder. Now if we do the hip, we do the posterior portion first. So right on here sits, right, that big gluteus maximus. If we take that off, we've got a gluteus medius, which is the one that's most superficial, and that's the cut one. Then we have a gluteus minimus. We have that piriformis, high probability question, right? I spoke about this in the relationship to the sciatic nerve. The superior gemellus is right there, the tiny one. And then this one here is the obturator internus. Flip them around. Here's the iliacus, and this is the psoas major. Together, they make the iliopsoas muscle, or that filet mignon, right, if we were a butcher. Okay. Want to go over this guy?
Mm-hmm.
You have this?
Yeah, well, I do.
Okay, so let's just do this real quick. Frontalis, occipitalis, I'm sorry. Frontalis, temporalis, occipitalis. Orbicularis oculi, orbicularis oris, your mentalis. Buccinator right there, right? More superficially, you have your masseter, you have your risorius, zygomatic major, zygomatic minor, okay? These would be your pectoralis muscles. This would be your sternocleidomastoid. Here's your trapezius. Here's your trapezius. This is your rhomboid major, your rhomboid minor. Galea epineurotica up top. That's that. You want to go over this? Do you need to go over these? Because these are
No.
these are can be really on the slides, right? Because these are pretty simple.
Put it up. Yeah.
Yeah, we have that one. That's the first one.
So here's your abdominal region, right? So what do we have in this? You have your pectoralis muscles. We have your rectus abdominis. And we have your linea alba. And then your more superficial muscles, right, that actually run right underneath this are your external obliques. How do I know they're externals? Because they run this way. The fibers run this way. Actually, they come right off the serratus anterior. The internal obliques run this way. Fibers do this. It's the only way you'll know. Your transverse abdominis are these right here. So actually, if you go like this, if you look at the layers, without even looking at this, these are the external obliques, these are the internal obliques, these are the transverse abdominis. But remember what I said, if I have this thing turned over like this, transverse abdominis, right? Because there's nothing else I would really point to here. That's it. And there's nothing really else. I mean, you can look at this guy.